Lyme disease or Lyme borreliosis. Signs and symptoms. A red rash that is known as a bullseye appearance, which is called erythema migrans. This only occurs 3 to 30 days after the tick bite. These rashes are normally not itchy or painful. Flu-like symptoms may occur also, such as headache, nausea, myalgia, sweats, fever, and general myalgia. Diagnosis. This disease can be hard to identify if there is no rash, like the bullseye rash that is on the right. But if flu-like symptoms occur again, then it can mean that the Borrelia has reached the organ system. Around 15 to 25% of people are untreated or are not treated properly and develop neuroborreliosis. People may be misdiagnosed for multiple sclerosis, Bell's palsy, Guillain-Barré syndrome, Parkinson's disease, stroke, and dementia. Lyme neuroborreliosis. This is when Lyme disease goes untreated or is not treated correctly. This can cause neurological symptoms that can affect the peripheral, central, and autonomic nervous system. These problems can lead to unstable pulse and blood pressure, which can be in the form of POTS, which is postural orthostatic tachycardia. This may also cause dizziness and headaches. Treatment. Once someone is correctly diagnosed with Lyme's disease, the treatment consists of antibiotics. Erythema migrans, which is the red bullseye that was described before, should be treated first and foremost, because the results from the serology test are most likely going to be negative, since the antibody response usually takes weeks to develop. Disseminated Lyme's disease, which is when it becomes serious with the neuro, cardiac, or arthritic problems, are treated with intravenous sulfarizone. Any treatment at an early stage is normally going to have a better outcome, and that's the same with this disease. Prevention. To prevent Lyme's disease is to basically stay away from any ticks. This means don't walk through the woods or tall grass with exposed legs or arms. Insect repellents containing DEET are effective to keep ticks away. Always check for ticks after coming in from outside. Spring through autumn and the summertime are times Lyme disease spikes, so that's the time to look out for it. Always a good idea to check your pets for ticks too when they come inside, and use a good tick repellent on them. Different forms. There are many different outcomes from being bit by a tick and contracting Lyme's disease, which include Lyme neuroborreliosis, Lyme arthritis, Lyme carditis, acrodermatitis chronicum atrophicans, Borrelia lymphocytoma, ophthalmic complications. Complications with Lyme's disease. Patients get antibiotics when they are found to have the erythema migrans rash or Lyme's disease, but sometimes after they are treated, they are still in pain or have the DNA from the infection. Lyme arthritis is one that is normally found after antibiotics are used to treat the disease. There is controversy if the serological tests are reliable or not, because if they take the test too early, then it will be negative. This can occur with other diseases also, but with Lyme's disease, if someone has the erythema migrans, then they will get treated whether the test is positive or negative. How to remove a tick. First, use fine-tipped tweezers and grasp the tick closest to your skin where the head is. Then steadily pull up without twisting or jerking the tick, which could result in the tick's mouth to get stuck in your skin. If this does happen though, use the tweezers to remove the parts. If unable, then let the skin just heal right over it. After removing the tick, clean the area with rubbing alcohol, an iodine scrub, or just soap and water. Dispose of the tick by flushing it or drowning it in rubbing alcohol. Never smash a tick with your fingers to kill it. Stages of ticks. There are 3 different stages of the ticks. The larva, which is the smallest, the nymph, then the adult. As you can see on the right, the adult female is much larger than the adult male. When they are engorged, they can be about the size of a pea. And my works cited.